All right, hey, good evening, y'all. Hey, Dr. Barry here, your favorite board-certified internist, founder of drpiersblog.com, as well as the host of the Lunch and Learn with Dr. Barry, bringing you episode 58 of the Empower Yourself for Better Health series. We are talking about pain this week, and I think it's kind of been apt just because we've been talking about pain quite a lot, especially on the podcast. If you haven't catch episode 80, 81, we first talked about some of the physician fears when dealing with pain. And then we followed up with episode 81, a more personal episode where we talked about what happened when I got that phone call when one of my patients actually overdosed from pain medication. So I definitely wanted to make sure we touched this base up with the Lunch and Learn on the live stream, where we just talked about pain, and we just kind of, and then of course it wasn't by accident that I'm talking about pain. September is Pain Awareness Month, right? So all of these things kind of tied in together, which is gonna make a good episode today. So today we're gonna do some housekeeping things. We're gonna share alike. When you get on, go ahead and share for me, please. Much appreciated. And the most important thing, we'll be talking about pain. We're gonna be giving a couple of recaps of the past couple episodes and what's to come on the Lunch and Learn with Dr. Barry, especially the podcast. We have a very special guest on the way. So I'm very excited for you guys to get in touch with listen to the next episode. I'm excited about that, especially, and again, it's still going to be on that same theme of pain. So let me do what I always first. Let me just go ahead and share this along here. I'm going to share button. Yes. All right, so we are back again. Sorry about that. It took a little bit longer than expected. My computer is slowing up. And of course, obviously, we usually don't do these things at nighttime, right? I usually like to, make it a Lunch and Learn episode, so you're usually doing it during the day. But today was actually much busier in the hospital than expected. I had a few meetings that kind of ran over late, and by the time I had some time to be able to do it. I didn't want it to feel rushed. I said, you know what? We're going to do a nightly episode, and we're used to a few night episodes of the Lunch Learn. And again, there's never a good time. I guess there's never a bad time to learn, right? So I want to, again, kind of just wrap up with what we're talking about, especially when we talk about pain. As an internist who does hospital medicine and he used to do outpatient medicine, is definitely something I'm very familiar with. When I was training as a resident, and I'm in the state of Florida, so when I was training as a resident, they had new laws that had just passed that talked about, hey, thank you for joining. They had new laws that just passed that talked about cracking down on the opioids, right? So it felt like almost overnight, overnight, we had a lot of admissions, right, for people who were either withdrawn from their drug medications, who were overdosing from their medications, all because our government, especially in Florida, stopped what we called pill mills, which was, where, you have a physician who, you see that physician, you pay the physician cash, and then you go towards the back, right? And then you get a handful of pain medications, right? Like that was actually legal in, in like 2010, right? In 2010, that was actually legal to have, right? Or again, you just go to the back. I have my own little pharmacy. I bought those medications in bulk, and you paid cash for everything, right? So again, just terrible management of pain, especially at that time. So when that happened, you saw this spike, right? You saw this spike of patients who were overdosing medications, patients who were withdrawn from the medications, because patients who used to be able to get, 100 pills a month all of a sudden they can't get 100 pills from their local physician, and trying to go to the Walgreens, the CVS's of the world was not happening, right? Because they were like, nope, if you didn't get those pain medications from me, I'm not going to be the one to give it to you. Right? Even to this day, I used to have patients who had a lot of trouble getting their pain medications because pharmacies either wouldn't fill it, or pharmacies had their own personal quota where they said, you know what, once I reach 20 patients who require chronic pain medications, that's all. Like, I'm not doing any more, any less. So they'd end up having to go to pharmacy after pharmacy just to find one pharmacist who will actually fill a prescription, right? So definitely, I know, right? Definitely something that is mind blowing when you think about it, right? But it tells a lot of the story of what we see now, right? Right. What you see now, especially when we're watching TV, or we're listening to the news, right? You hear about this opioid epidemic, you hear about the opioid crisis, you hear about all the abuses, the drug overdoses, the drug withdrawal. You hear about all of these bad things, but this is what was happening again, not even a decade ago, right? Not even 10 years ago. This was like the norm. So we as physicians, right? Again, I think we have to take some of the blame, right? Because we kind of set them up for it. And what's happened now has been this like 180 when we talk about pain, when we talk about pain control in regards to how we're prescribing pain medications, how we're monitoring pain medications. And before we used to put a lot of the onus on the patient, right? Like it was all the patient's responsibility. And then the government is like, no, 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 the patient isn't just like magically coming up with these medications, right? You're giving it to them, right? So now they started putting the pressure on the physicians. And then the pressure started getting put on the pharmacists, right? So then all of a sudden, everyone's being held responsible for, Susie Joe, right? For overdosing the medication, right? Because again, it doesn't just happen overnight. Again, when we talk about the heroin, right? Because heroin's a big thing, right? When we talk about heroin, what usually occurs is a person has some type of pain, some issue that requires them to have pain medication, and their body gets addicted to that pain medication. And before it used to take one pill to deal with their pain, now a day, now it takes two pills, then it takes four pills, and then all of a sudden they run out all of their medication and their body is still in pain. And then that's when they upgrade and that's where the heroin comes, right? So that's why heroin's such the big thing, because after you dealing with those prescription medications and you can't deal with any of those medications anymore, you go to the heroin, right? You go to the IV medication, right? So again, that's kind of the setup, right? That's where, the issue kind of lies, right? Like we have set up a society, right? And I talked to the pharmacists, I talked to the physicians, we set up a society where we can't deal with pain, right? Like we cannot be in any type of discomfort. So the second you're in any type of discomfort, you need someone to take care of it. And it's different. It's just different in different countries, right? So different countries understand like, hey, you know what? I just had surgery. I'm going to be in some pain. I'm going to be in some discomfort, right? Like they kind of understand that. In our society, we don't really. That's not the case, right? And that's so not the case, right? That it's gotten to a point where especially I'm in the hospital now, right? So hospitals actually get dinged for pain control, right? Versus like not having good pain control. You know how they do it? They ask the patient like, "Hey, was your pain controlled 100% of the time?" Right? And if you're a patient who's in chronic pain, you're like, "Nope, it was not. It wasn't in control 100% of the time," right? So now what the hospitals do, right? Hospitals are saying, no, 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 give this person their pain medication as much as possible because we want good scores. Because good scores mean that they don't get docked from a financial standpoint, right? So again, a lot of it, and this again, we're coming back to the finances when we're talking about this pain issue, right? Again, which kind of set up to where we're leading to. So you get to that point where you, as a physician, right, you're forced to treat pain, whether you're treating the pain inside the hospital, outside of the hospital, you're forced to treat the pain, right? Because your patients are coming to you, they're in pain, they're in agony, they're crying. And I talked about it in episode 80 of the podcast where I had a patient come to me crying because she couldn't get to her pain management doctor in time, right? Her pain management doctor appointment was a week away, but she had ran out of medications, and she was literally bawling tears in my office, right? Because he needed that pain medication, right? Like that's what these pain medications do, right? They make it so your body becomes so addicted to it, so dependent on it, that if you miss one dose, if you miss two doses, you miss it by a couple hours, you're in agony, you're in pain, and then lo and behold, your pain is uncontrolled, right? So I think the that premise, right, set up this 180 that we as physicians have had when it comes to treating pain, right? As a licensed physician, we are allowed to treat pain. We just are, right? Like licensed physicians, we are licensed to be able to treat this type of pain. And it's not like it's difficult to treat this type of pain per se, but what's happening is this fear that I don't want to be responsible. I don't want to have to deal with your pain. I don't want to have to deal with the complaints, the calls. I don't want to have to deal with the low satisfaction scores. You guys, patients, right? You guys are quick to go on like Yelp and all these other like Doximity and all these other, grading websites, and you say, this person treated my pain poorly, get them out of here, right? So physicians don't want to deal with any of that, right? So they say, you know what? I'm just not going to take care of you, right? I'm not going to deal with you who takes pain medications. You need to go to someone else. You need to go to a specialist, right? And again, I'm not saying specialist because there isn't a specialist. There actually is pain management specialists who go through fellowship training. I'm not saying that. But in the physician's eyes, right, they're saying, like, I'm not going to take care of your pain anymore. You need to go find someone who's specialized in pain because only they can take care of your pain, which isn't true. What's true is that physicians are afraid to take care of pain, right? They don't want to have to deal with the problems. They don't want to deal with the concerns and all the issues associated with taking care of your pain. And if you listen to episode 81, right, I talked about probably the worst case scenario, right? They don't want to have to deal with the phone call that they get that says that their patient overdosed, right? So that's the unfortunate aspect of this pain control and this era where opioids is such a huge thing, is that you can overdose from these pain medications, and you can overdose and more importantly you can overdose and die, right? So I had a patient, again, if you check episode 81 out, where I had a patient who died from an opioid overdose, and it was from pain medications that I used to prescribe them, right? So pain medications that I was, writing, every month. And again, and I did all of the steps you need to take. I'm going to talk about that in a second. I did all the steps you needed to take to do lawfully and, willingly prescribe it, but still they got their pain medication and maybe they got outside medication. We're not sure. I never really followed up on that. But, the ultimate issue happened, right? The person died. The person died from an opioid overdose. And if you look back at the medications, Dr. Pierre was one of the people who used to write pain medications for this person, right? And that's why they called. Well, I was his primary care physician, right? So that's why they called me anyway. I'll take it back. I was his most recent primary care. He stopped seeing doctors, right? So I was the most recent one, right? Which is unfortunate, right? And that's like the ultimate fear, right? Like the other fear, like, oh, I can't control your pain, I don't know how to do. That's BS, right? That's the BS excuse we use for our patients. But the real, true fear, right, of why physicians are very hesitant to treat pain is because they're scared that they don't want to be the reason why you pass away, right? Like that's their big fear, right? That if a physician tells me like, hey, I don't want to give you pain medications, I don't know how you deal with it, and if something happens, I don't want to be responsible. That's okay, right? Like that is a viable excuse, right? But the excuse we tend to give patients isn't that, right? We give them I don't know how to handle this pain medication. I'm not familiar with this pain medication, and for the most part, I can't prescribe this pain medication, and that's totally false, right? Like you can prescribe medication. There's no relationship that you couldn't prescribe said medication, right? You just don't want to, and again, that's okay. Again, for those who've been following me know, I'm actually a proponent of medical marijuana, right? I think it's going to be one of those medications that replaces a lot of these opioid prescriptions, replaces a lot of these benzo prescriptions, right? So I'm a fan of the opioid medication, I mean the medical marijuana medication because of that, right? Because I think it's a much safer alternative to what we got going on now. What we got going on now isn't very good, right? But the alternative, where we talk about medical marijuana, acupuncture, all these alternative ways to treat pain, I think that's where it's at, and I think that's where we need to go. Right? I don't think it's a maybe we should go. I think that's where we need to go. We need to be treating and finding different ways to treat people's pain, right? Because the way we're treating it now is absolutely terrible, and it's causing a lot of deaths. Again, we won't go through the numbers. You can check. You can check my episode 80, right, where I talk about some of the numbers of, to opioid related deaths. Reuters dropped an article a few weeks ago that talked about 1 out of 10 people who commit suicide are dealing with chronic pain, right? Now, they're not saying there's like a direct, relationship between chronic pain and suicide. They're just saying that we're seeing that out of the people who commit suicide, 10% of those have chronic pain history, right? Like 10%. That's enough for you to be like, kind of raise your eyebrows and that's something I need to be very wary about, right? So again, I think that's definitely important when we're talking about pain, when we're talking about pain control. And and that's what leads us to this month, right? This month again, I didn't just kind of randomly choose to talk about pain for one, in the Lunch and Learn survey that we did last month. One of the topics that people wanted to hear about was pain, right? So of course, I'm checking that box, right? People want to hear about pain control, so boom, we're going to talk about pain control. That box is checked. But most importantly, September is Chronic Pain Awareness Month, or just Pain Awareness Month. And it's been something that's been going on for almost 2 decades, right? Since about 2001, where we've been celebrating, Pain Awareness Month in the month of September. And for those who don't know, in fact, what I want to do, I'm going to put a link to their website, the American Chronic Pain Association, very good website, especially for those who may be dealing with pain, who may have family members dealing with pain. And this video will be on the website as well too, if you don't catch it on my Facebook page, and we'll make sure the link is in there. Let's see. I'll do that. So yeah, American Chronic Pain Association, great organization, has a lot to deal with pain. It has a lot of great information about pain. In fact, they have a booklet that's about 150 pages just talking about pain, what is pain, pain control, like very, very, detailed reading, but it's easy reading. It's not like medical jargon that only the physician will be able to pick up. Right, it's very easy reading. But again, they want to highlight, pain, right? They want to highlight the fact that, there's a lot of people in pain. It's causing a lot more problems. It doesn't. And I think the most important thing, especially when we talk about pain control, and they actually talked about that on in their website, is pain doesn't only affect the person. It affects the family members. It affects the people they got to take care of. It affects people who have to take care of them, right? So a lot of different people get affected by someone's pain, especially when it's in a chronic nature, right? So I think that's important to know, right? Because I think a lot of times when we talk about any type of disease, a lot of times we focus the disease on specific patient, but don't really talk about like that's the sphere of influence that it has on everybody else around them, right? So, and pain is not good, again, especially in our society, U.S., where we're not used to being in pain. Just like from I'll relate this to my people who get cold. You get a cold, you go to the doctor's office. You're not used to your doctor saying, "Hey, that's viral. You know what? You don't need any antibiotics to sleep it off." You're not used to that, right? You used to be able to go get cold-like symptoms, go to your doctor's office after you pay that copay, and then get a prescription for antibiotics. And when you run into doctors, like me, right, who's like, "Yeah, I don't think you need any antibiotics," you're like, so the same thing with pain, right? So you have these people who are in pain and discomfort, and they remember a life where they was pain free, right? They remember a life when they were pain free, and they want to get back to that life, right? You can't tell them like, hey, you got this chronic pain. It's gonna be gnawing. You're gonna be a little uncomfortable, but you got to be able to live with that. That's not the way they live, right? They live pain free. So if you can't get them pain free, they're gonna get medications that get them pain free. Right. And that's where these medications, these opioids and all those medications come in, because they help them get pain free. And they're like, I'm a new person. I'm back to a new person. Oh, my pain is back. Let me go take another medication. Boom. Couple hours. Oh, my pain is back. Let me go take another medication, right? Like that's the cycle that keeps on happening. And so I want you guys to stay tuned. Again, we did 2 podcast episodes where we talked about pain. We're going to do a third one. I'm actually have a special guest on that. I'm going to keep it under wraps until that, happens, right? But we're going to have a special guest talking about pain control from their perspective, right? Hint, hint, it's going to be a pain person, right? We're not going to say who, but again, we'll keep it under wraps for there. And again, I want to say, thank you guys for all the support, especially those who, checking out the podcast. If you have not, make sure you hit lunchlearnpod.com, subscribe at your favorite outlet, whether it be Apple Podcasts, whether it be SoundCloud, whether it be Google Play, wherever you like listening to podcasts. And maybe if you don't like listening to podcasts, just get it and listen to Minds, right? Like that's important, right? And those who catch this live stream video, again, much appreciated. Especially those who are going to catch the replay. Again, just to kind of wrap up, we talked about pain. We talked about pain management. We talked about Pain Awareness Month and the importance of looking out for your family members who deal with pain, who deal with discomfort, and, let them know it's okay and let them know you're here for them, right? Again, and I want you to check out that link in the American Chronic Pain Association. So if you got any family members who have to regularly, and I'm not saying like, you just had surgery, you got a couple of pain pills, but you don't have to use them no more. I'm talking about the ones who regularly have to use pain medication every single day for a month, 2 months, 3, like that's their thing. Like point them to that website. There's a lot of information that they could use that, they can get their understanding right. Because when you're dealing with chronic pain, and this is something I have to tell my residents, when you're dealing with chronic pain, you may not necessarily look like you're in chronic and agony and pain, right? And that's the thing that it happens a lot for my sickle cell patients, right? For those who may have someone who has sickle cell disease, right? My sickle cell patients, they usually look comfortable, right? They may be grimacing, but they usually look at least comfortable, but their pain is like off the roof, right? And that's because they've just been able to deal with their chronic pain for so long to be able to do their chronic pain that you're not going to get them balled up, crying and tearing. Some of them you will, but for the most part, you're not, right? Because they've been used to the pain, right? But that doesn't mean that their pain isn't just as valid, right? That doesn't mean that their pain shouldn't be taken care of like someone else's pain. That just means that they're able to deal with what they're able to deal with from a pain scale, right? So I think that's the most important thing, right? Especially if I just want to end it there. I want to talk to the people who are dealing with pain and say, as a physician, we believe you. We know you have pain. We know you're uncomfortable, and we're going to get the help, right? And it's going to be a 50-50 relationship. You help us. We're going to help you get to your pain goal, right? And as a physician, the thing I need to do is let you know that your pain goal may not be pain-free, right? Like if we say, if I can end that, your pain goal may not be pain-free, right? Like we may never be able to get you to the point where you're 100% pain-free. But if you can do your daily activity, you can move around, you can go to work, you can eat. If you can do that, like I think that's a win-win for everybody.